Again, my name is Lars Peterson. I'm the Vice President of Research for the American Board of Family Medicine, and I'm also an Associate Professor of Family and Community Medicine at the University of Kentucky, where I'm still active in patient care. There, I'm also an investigator with the Rural and Underserved Health Research Center. And I grew up in a rural area and knew I wanted to be a family physician since third grade. And then when I got into medical school and got the research bug, I naturally gravitated towards rural health and did my dissertation on it, always thinking about where I grew up and the area I loved. So in my current role, I'm actually a fellow at the National Academy of Medicine, one of the anniversary fellows. And when I learned about what was going on at the Academy, and we did this kind of, hey, learn about the Academy and what's happening, I quizzed everyone about, what are you doing rural? What's happening rural? Like, is there something rural I can do? So I was really fortunate that the round table came up with this workshop and was able to get on the planning committee to put together this fantastic presentation we have for you. And as part of that, I will moderate the first session. And this session will lay the groundwork and context of rural areas in terms of demographics, social determinants of health, and structural urbanism, and will serve as a departure point for the rest of the workshop. And I hope you'll stay around and join for all of it. After the presentations today, we'll have about 15 minutes of question and answer, and then go to the next session. To start us off, we have Alana Knudsen, who is a principal research scientist and the co-director of the Walsh Center for Rural Health Analysis at NORC at the University of Chicago. Dr. Knudsen is also the deputy director for the Rural Health Reform Policy Research Center, one of 7 rural health research centers funded by the Federal Office of Rural Health Policy. She has 20 years of experience implementing and directing public health programs, leading health services and health policy research projects, and evaluating the impact of programs. Her research and policy findings have informed state, tribal, and federal health policy. She also has state and national public health experience, having worked at the North Dakota Department of Health and for the Association of State and Territorial Health Officials. After her talk, we'll have the second speaker in the session is Dr. Janice Probst, who's a distinguished professor emerita at the University of South Carolina Arnold School of Public Health. I've just got to meet Alana through this workshop and planning it, but I've known Jan, I think, for 14 or 15 years, and I've always enjoyed her talks and perspective. And Dr. Probst is a nationally recognized researcher in the area of health services and policy, with a specific focus on rural health and health disparities. She was a founding faculty member of the Rural and Minority Health Research Center, which was established in 2000. Dr. Probst is a member of the National Rural Health Association Health Equity Council and serves on the board of directors of the South Carolina Office of Rural Health. Please refer to your attendee packet for the complete bios. They're both impressive people. So we'd like to thank you for lending the National Academies your time and expertise and to help us understand the context for the rest of the workshop. And with that, I'll hand it over to Alana.